Hello, everyone. This is Dr. Sho, and here we are going to conclude the discussion on Introduction to ANS. In the last discussion, we ended by discussing chemical transmission, and here we are going to continue along that trajectory by discussing neurohumoral transmission. And what is neurohumoral transmission? This simply refers to transmission or transfer of a nerve impulse through a synapse from a presynaptic or neuroeffector junction to a postsynaptic neuron or effector cell by means of a humoral agent. So, by that definition, we understand that two things are involved: neurohumoral. So, that means there is an electrical aspect whereby an action potential is generated, and also there's a humoral component whereby a neurotransmitter is released. We still remember the role of acetylcholine and noradrenaline, and we still remember where they are secreted in the autonomic nervous system. These two are the principal transmitters of the autonomic nervous system. But apart from these two, there are other minor neurotransmitters that are released from neurons called non-adrenergic, non-cholinergic fibers. And these minor neurotransmitters include nitric oxide, serotonin, 5-hydroxytryptamine, ATP, dopamine, GABA, purines, and peptides. This diagram here is merely explaining to us what we described earlier when we said acetylcholine is the neurotransmitter for all preganglionic autonomic fibers, whether sympathetic or parasympathetic. So, what are the steps in neurohumoral transmission? The first step is axonal conduction. The second is transmitter synthesis. The third is transmitter release. The fourth is the receptor events. And the fifth is transmitter destruction. We'll look at these ones very quickly. Axonal conduction. First, what is conduction? Conduction refers to the passage of an impulse along an axon or muscle fiber. We remember that the normal resting membrane potential is minus 70 millivolts negative inside to the exterior. So, at rest, the sodium concentration is high at extracellular space and low in intracellular fluid, whereas the potassium ion concentration is about 40 times higher in intracellular fluid relative to the extracellular fluid. So there is an ionic gradient, and this ionic gradient is maintained by the sodium potassium ATPase. With the arrival of an electrical impulse to a nerve fiber, or with the stimulation of a nerve fiber, there will be a sudden increase in sodium permeability with influx of sodium ion into the fiber, thereby increasing the positivity inside the fiber. That is, there is depolarization. Then potassium ion will then move out of the fiber in the direction of their concentration gradients to repolarize the cell, thereby restoring the normal resting membrane potential. And this sequence of events are called action potential. And this action potential that is so generated will set up local circuit currents. And this action potential will be propagated along the axon without decrement. There are two toxins produced by fish. These two toxins are called tetrodotoxin and saxitoxin, and both of them block axonal conduction by selectively preventing the increase in sodium ion permeability, thereby causing persistent depolarization and spastic paralysis. Local anesthetics also interfere with sodium permeability and block axonal conduction, and this is the basis of their use in surgery and other conditions in which local anesthetic agents are required. The next step is junctional transmission. And what happens here? With the arrival of the action potential at the axonal terminal, a series of events will be triggered. The depolarization of the area will lead to the stimulation and opening of the voltage-gated calcium channels, leading to influx of calcium ion into the axoplasm. And calcium ion is essential for the fusion of the exoplasmic membrane and synaptic vesicles. So with the fusion of the exoplasmic membrane and the synaptic vesicles, an opening will there will be an opening traversing the two membranes, and the contents of the vesicles will then be extruded to the junctional cleft by the process of exocytosis. The transmitter release can be regulated, and the regulation can be by the transmitter itself, that is autoregulation, or can be by other agents through their interaction with prejunctional membrane receptors. So you can have norepinephrine acting through alpha 2 adrenoceptors, dopamine, acetylcholine acting through muscarinic 2 receptors, adenosine, enkephalins, and prostaglandins, all inhibiting norepinephrine release. Then acetylcholine again acting through a different subtype of receptor now, that is nicotinic cholinergic receptor, and isoprenaline acting through beta 2 receptors promotes norepinephrine release. The release of acetylcholine from the cholinergic neurons is inhibited by alpha 2 adrenergic and muscarinic agonists. The next thing is the postjunctional event. And what happens at the postjunctional event? The release transmitter will migrate across the synaptic clefts and bind with their specific receptors on the postjunctional effector cell membrane, thereby resulting in increased sodium permeability and the propagation of an excitatory postsynaptic potential, EPSP, with stimulation of effector organs. This is the situation for excitatory neurotransmitters. But for inhibitory neurotransmitters, there will be increased permeability of the membrane to potassium ion and chloride ion, and both of them will move in the direction of their concentration gradients, thereby resulting in hyperpolarization and the propagation of an inhibitory postsynaptic potential, IPSP. The IPSP will stabilize the postsynaptic membrane, thereby increasing its threshold to stimuli. Then, apart from EPSP, and IPSP, there's another potential called MEPP or MEPS. MEPS means miniature end plate potential. What happens here is that small amounts of neurotransmitters are released slowly but continuously from the nerve endings during its resting state. This amount of neurotransmitter that is so released is not sufficient to elicit a response, but it produces an electrical potential at the postjunctional membrane. And this electrical potential is what is called miniature end plate potential. And its function is to maintain the normal sensitivity of the effector organ to the neurotransmitter. Next step is the termination of the transmitter effect. And termination of the effect of the neurotransmitter can be, number one, by diffusion away from the synaptic cleft. It can be by reuptake into the presynaptic nerve terminal, or can be by enzymatic hydrolysis. For acetylcholine, the main mechanism of termination of its effect is by enzymatic hydrolysis, and the enzyme responsible for that is called acetylcholinesterase. Whereas for noradrenaline, the main method of termination of its effect is by reuptake. Diffusion also plays a secondary role. Then there are two enzymes that also metabolize noradrenaline and adrenaline. And these two enzymes are called MAO and COMT. MAO is monoamine oxidase, while COMT is catechol or methyltransferase. You are going to hear more about MAO later because drugs that inhibit the enzyme MAO, monoamine oxidase, are used in managing depressive illness. So we'll still discuss this at a later date. Thank you for watching. Please like and subscribe to my channel. You can contact me on that number for mentoring, for personal coaching, and for further explanation or research work. These are some of the practice questions for you, together with their answers. Please go through them. Thank you.